A new letter from nonprofits and medical experts calls for changing how painkillers are prescribed. More than 14,000 Americans died in 2014 from misuse and abuse of prescription opioids. Jim Axelrod began reporting last year on one doctor in West Virginia who said he prescribed oxycodone to almost every one of his patients. That physician is under investigation. Now he's opening up about the controversy he faces. Jim, good morning.
Good morning. West Virginia's doctors have some of the highest opioid prescription rates in the country, writing 138 scripts for every 100 people. In the last 3 months, 7 doctors in West Virginia have had their licenses suspended or revoked, including the doctor who spoke with us.
At the end of this narrow, unpaved, pothole-filled 2-mile logging road, Dr. Michael Kostenko operates the Coal Country Clinic.
This is our class on diet, class
treating
5.
Patients for pain.
What percentage of your patients get prescriptions for oxycodone?
Nearly 100%.
How many patients do you have?
At any given time, we're 800 to 1,000 active patients.
One of West Virginia's top 10 prescribers of painkillers, he's written more than 40,000 prescriptions for oxycodone in the last 2 years. Even he can't keep track of exactly how many prescriptions he writes.
Did you write 325 prescriptions the first week of January for more than 19,000 oxycodone pills?
Possibly.
You don't know how many prescriptions you wrote?
I don't. It may well be.
There's a lot of stress going on.
Dr. Kostenko hosts group sessions at his clinic where he explains his approach to treating disease and pain through changes in diet and behavior.
And then more and more of these toxins are going to get through.
After filling out a medical self-assessment, each patient pays $120 in cash. At the end of each class, they're handed their prescriptions for pain meds. There are hardly ever private exams.
There's very little that we need to do in private.
In other words, a conversation confidential about my use of pain medication, that wouldn't occur in private?
Everyone's on the same pain medication.
In the last 2 years, 3 of Dr. Kostenko's patients have died after overdosing on a cocktail of pills, including oxycodone prescribed by Kostenko, along with pills prescribed by other physicians.
Don't you have an obligation to talk to the other doctors to make sure that cocktail isn't fatal?
If the conversation would be productive, absolutely.
Well, the patient's dead, so how could the conversation be any less productive than what happened?
There should be better communication between all physicians dealing with these drugs. There just is not.
Robert Knittel is the executive director of West Virginia's Board of Medicine.
You have 14 people in your office. 1 is an investigator, and this is the state with the largest oxycodone abuse problem in the country?
Yes.
Sounds like you're saying this with a little bit of exasperation.
Well, we're overwhelmed.
The state has suspended Dr. Kostenko's license while they investigate the deaths and decide whether to revoke his license. He didn't seem to help his case when discussing one of the deaths with us, a woman being medicated by another physician, a Dr. Kostenko never consulted with.
Do you bear any responsibility for that death?
Yes, I do.
The board will rule on Dr. Kostenko's license in the next month. He is among 15 doctors in West Virginia who are under investigation right now for their prescription practices.
Are you surprised he accepted blame?
Well, his point was that he didn't know what kind of critical shape this patient was in. He wishes the hospital where she had been treated had reached out to him. I will say this, there are 2 other fatal overdoses in patients of Dr. Kostenko being investigated right now.
He had a couple of humana moments to some of your questions. I'm surprised he even talked to you at all.
That makes 2 of us.
Okay. All right, Jim.
Incredible
You are that
reporting.
good, Jim Axelrod.
Incredible reporting. And let's take a
Yes.
moment to congratulate you and producer Emily Rand on your George Polk Award for investigative journalism.
Thank you so much, Norm.
You're very
Thank you.
welcome.
Absolutely.
Yes, thank you for